And we continue our Newsmaker show now with St. James Hospital. We have a new pain management doctor on the line with us. His name is Dr. Gabriel Yacob. And also with us is Kate Krieger from St. James, the marketing director. So saying hello first to Dr. Gabriel Yacob.
Hello, how you doing? Good morning, everybody.
Hello, doctor, and good morning to Kate Krieger.
Thanks, Brian. Glad to be here.
Well, you're a new pain management specialist at St. James Hospital. First off, doctor, if you could give us kind of a basic explanation of what does a pain management doctor do?
So, the pain management doctor, we start actually with taking the medical history of the patient and doing a physical exam to identify the source and the etiology of the patient's pain. As you know, pain is a symptom, is not a disease itself. So sometimes actually you need also a workup to identify the source of the pain and what's causing exactly the pain. And then the management actually could be conservative, including the physical therapy or medication management, or like a minimally invasive interventional procedures to limit the amount of medication and the painkillers usage. And as you know, the side effects and the consequences of the painkillers for the long term, I mean mainly the opioid pain medications.
Right, and I want to get back to the opioid question, because that's been a big issue over the years. But I did want to ask you, as far as COVID-19 goes, were you part of the hospital during, how long have you been at St. James, is my question. Were you there for the height of the COVID problem, or are you more new to St. James Hospital?
No, I'm new to St. James. I started actually on June 1st. So
okay.
I was not sure, yeah.
So the worst of it was over by that point, June the 1st at St. James Hospital. We had the St. James doctors on quite frequently, as well as the St. James CEO, Brian O'Donovan, during the height of the COVID period, which was something that we'd never seen anything the likes of before, and hopefully we never will again, the whole COVID-19 situation. Back to the basic questions with you, Dr. Gabriel Yacob. Your background, if you could give us a little information about that and how you got interested in pain management.
So my background, I was trained as anesthesiologist with subspecialty training in chronic pain management. As you know, actually, pain management is a vital part of the providing anesthesia because you have to control the patient's pain during the procedure or surgery and post-operatively as well. But that's more or less as acute pain management. But one of actually the subspecialty training in anesthesiology is to be trained in chronic pain management. And that's what actually I have done fellowship training for more chronic pain management as well.
Sure thing. And I'm on the website, so it says you went to University of Pittsburgh Medical, and wanted to ask you some more questions. Before I get back to the question of the opioids, let's ask questions on the kinds of conditions that you treat normally and that you'll be treating at the new St. James Hospital.
So the majority usually of our patients are mainly the spine pain, either neck pain, which sometimes radiates down the upper extremities, or low back pain, which sometimes also radiates, causing down, sciatica pain down the lower extremities. Also, what we commonly see also joint pain secondary to osteoarthritis and rheumatoid arthritis, as well as also nerve pain or neuropathy pain, which is most commonly secondary to diabetes, and also the cancer patients, definitely, as we know, they sometimes also develop some sort of pain and actually that's a sort of fair number of patients we see, as well as the pain. I'm sure actually the shingles, the pain actually, some patients, they have the pain persist even after the disappearance of the shingles rash, and that's actually definitely a very troublesome actually pain problem as well.
Talking to a St. James Hospital pain management specialist, Dr. Gabriel Yacob. And, you mentioned in there the different injuries and types of pain that you treat. I'm looking at a phrase here I'm not familiar with because I was kind of curious as to what it is. It says spinal radicopathy or something like that. Not quite sure how to pronounce it. What's that, doctor?
So it's actually a sort of when sort of degenerative changes or wear and tear in the spine start actually, the body start form bone spurs, and that actually sort of irritate or pinch the nerve going down either the upper extremity or the lower extremity, and that's what causes the pain along the arm or the sciatica pain in the lower extremity. That's the more common. That's what's called radicular pain, which is the nerve gets pinched at the root of the nerve while it gets coming out of the spine.
Interesting. Talking with Dr. Gabriel Yacob, the new pain specialist at St. James Hospital. Do you treat children as well as adults, doctor?
So the chronic pain problems in children actually is not as frequent as adults. In children, the pain problems are mainly acute in nature, either secondary to trauma or after a procedure or surgery, or sometimes actually like cancer pain as well in children. But it's more or less actually in adults, having, more medical problems and the wear and tear and the degenerative changes in the spine and the joints. And that's what the majority of our patients. But every now and then we do sometimes see children with chronic pain, but it's not as often and as frequent as adults.
Guessing that a lot of the younger patients would be coming to you, just a guess, for sports injuries. Would I be correct there, doctor?
That's correct, yes. And usually it's managed, a sort of acute or subacute and gets resolved, with conservative management usually.
Dr. Yacob, a new pain management specialist at the new St. James Hospital in Hornell. And I see, one of the types of pain that you treat, headaches and facial pain. Headaches we all kind of know. I'm guessing it's more or less at the migraine level if you're treating them. Would that be correct, doctor?
Yes, so the migraine actually management is mainly two components. Sometimes actually the main component is actually medical management or medication management, and that's usually done by the patient already being seen by neurologists. So the other component is sometimes they need interventional procedures or invasive procedures, and that's when actually my part comes in. If the neurologist thinks that might be a procedure can help the patient's chronic headache or migraine.
The other phrase that was in there with headaches is facial pain. How would you develop facial pain? Not terribly familiar with that as a symptom, doctor.
So there's a couple of, certain nerves in the head and neck area that can be irritated, and the most common one was called the trigeminal nerve. And that's what causes most of the facial pain. And it's actually a nerve that comes out from the base of our skull in the deep part of the brain, and causes actually, when it gets irritated, it causes actually a very bad, shocking kind of pain, especially with the chewing and moving your jaw. So that's actually the most common type of facial pain.
Talking with Dr. Gabriel Yacob, the new pain management specialist at St. James Hospital. Also on the line with us is the marketing director at St. James, Kate Krieger. Reading some of the other list of symptoms and illnesses that you treat. Back pain. Now, if someone had back pain, doctor, would they think, oh, okay, I'll call a pain specialist at St. James, or would they be referred by the regular MD? How would that work?
So usually we prefer, honestly, to see the patient after exhausting, more or less the conservative management, which usually done by their primary care doctor. So if they went through, first of all, if the pain lasted more than 3 months and is not getting any better with the primary care doctor's management, that's when actually they should be referred to chronic pain management for further management. And so we usually actually get the patient referred by their primary care doctors.
Okay. Dr. Gabriel Yacob, another question for you. Thinking about the COVID-19 and everybody staying inside, getting less exercise than they might normally get, even if the exercise is just walking. Dr. Yacob, how has COVID-19 affected the bulk of your patients, I guess I'd say?
So, as you know, the patients definitely are a little bit more or less reluctant to come to the hospital or to be seen in the office. And that's in general. It's not just only pain management. But definitely, as you know now, the cases a little bit, the number of the cases is getting less and less. And, the patient now more or less having more confidence to come to the offices. And we're starting actually seeing the patient coming physically in the office at the hospital. And the other thing is actually definitely sometimes of our medications we use, actually, it's a sort of immunosuppressant, and we definitely try to avoid or minimize that as much as we can.
We're going to take a quick break. We'll be back in just a moment with Dr. Gabriel Yacob, the new pain management specialist at the new St. James. Stay with us.
Hornell Partners for Growth like everyone to know that we are thinking of you and hope everyone stays safe and healthy. We are working with our district businesses to get all necessary information out that is required to ensure a safe and healthy reopening for all employees and community consumers. To stay up to date on openings, community events, Steuben County, City of Hornell, and Hornell School District information, please like and follow us on Facebook at Hornell Partners for Growth. There you'll find a list of businesses open with current hours updated weekly and posts shared from our businesses and local officials. Please stay safe and remember we appreciate your continued support to all local businesses.
Mullen Factory Direct Flooring in Almond is open, and they want you to know that they're following health and safety guidelines in order to keep everyone safe during this crisis. Mullins also understands that you may have a flooring project with a deadline that can't wait, like apartment renovations, new construction, an unexpected catastrophe. Whether you need it installed or you do it yourself, they'll do their best to make sure they take care of you with safety in mind and get that project done on time. They have over 500,000 square feet of in-stock flooring, and they offer special financing to qualified buyers. Mullen Factory Direct Flooring in Almond.
Well, we're checking in now with meteorologist Rob Carroll, who says another nice day for us.
That's right, Brian. More sunshine in store for the southern tier. The only difference today is going to be the temperatures. We're now getting into the warmer air spreading up from the Ohio River Valley. High pressure is in the process of shifting offshore, and that's leading to the warmer temperatures. So not as comfortable as it was yesterday, but it's going to be brilliantly sunny throughout the day. We'll find highs somewhere between 85 and 90 later this afternoon. Brian, we're working to our longest days of the year. The day now 15 hours and 13 minutes long. Sunrise 5:33 this morning. It sets tonight at 8:47. Tonight we'll have increasingly cloudy conditions. Humidity will come up overnight. Lows will be 65 to 70. For tomorrow, clouds and breaks of sun. Watch for a shower or a thunderstorm tomorrow afternoon. Breezy, hot, and humid with temperatures approaching 90. Tomorrow night, we're partly to mostly cloudy, scattered showers as a cold front heads our way 65 to 70. We'll turn partly sunny, breezy, and less humid for the day on Thursday. Highs will be 75 to 80. Even cooler weather will rise with some sunshine Friday, Brian. We're 70 to 75.
Back with Dr. Gabriel Yacob, the new pain management specialist at the new St. James Hospital. Doctor, how do you know that you should go see a pain management specialist?
So, if your pain is lasting more than 3 months and is not getting any better after all the conservative management, including physical therapy and some medication management like anti-inflammatory in the beginning, if the pain is not responding to that management, it's better actually at that moment to ask your primary care doctor to refer you to pain management before we get to, a more sort of stronger painkiller prescriptions.
What kind of treatments are you offering these days, doctors? What kind of treatments, what kind of procedures?
So we do actually interventional pain management through a minimally invasive procedure to control the pain, which usually done using imaging guidance by X-ray or under ultrasound. And that actually the main actually philosophy of that, to minimize the usage of the painkiller, especially the opioid pain medications. Also, we do medication management. That includes a varieties of medication, not just only opioid painkillers. There is a lot of actually varieties of other pain medications that are not addictive as opioid painkillers. And also, we sometimes get to the point that referring the patient to other resources, based on their condition and response to the treatment, either physical therapy or water therapy or hydrotherapy or acupuncture, and sometimes to surgical specialties, which if it's needed. The core of the procedure, we mainly do it like the spinal injections, which include the epidural steroid injections and nerve blocks for neck and the low back pain. That's either the pain before the surgery or even if the pain persists after the surgery. Also, we do joint injections, as well as there is a new modality actually, it's called neuromodulation, which is spinal cord stimulators and intrathecal pumps, which is infusing the pain medication in the spinal fluid of the patient to control the pain.
Dr. Yacob, you referenced opioids there. I know that there's some very strict laws on the use of opioids and how much doctors can prescribe them. What are the rules on opioids these days, especially in terms of someone who's in maybe chronic pain and needs something long-term? What's the rules there?
So the CDC actually guidelines now limited the primary care doctors about prescribing long-term opioid painkillers. So they limited actually to try to only for acute pain problems for 1 or 2 weeks maximum. But if the pain persists, they have to consult and refer the patient to chronic pain management. So the patient actually has a more or less to see if they have the workup that really the patient has the chronic problem that justifies the need for the painkillers, and are they a good candidates with a lot of factors, risk factors? Are they a good candidates for long-term pain management? And also, the guidelines also limit the total daily dose of the opioid to minimize the long-term consequences, as you know, which is mainly the physical dependence and addiction of the opioid painkillers.
Doctor, curious, what made you want to come to Hornell to practice medicine here?
So I actually was practicing pain management in the Southern Tier area before in the past, in Olean area, Olean General Hospital. And I just moved actually away for a couple of years, and actually I'm back again. I like actually to serve in a small communities, And I really, I was there, and I was here in the Southern Tier area for about 4 years, and I really liked it, and I missed it, and I'm back.
That's great. Great to hear. And, Doctor, wondering where your office is. Are you in the new St. James Hospital? And where are you located?
So the office actually is in the office building.
The new medical office building.
Right. Next to the hospital is 7309 Seneca Road in Hornell.
Okay, and how does somebody make an appointment to see you if they're having pain problems there?
Yeah, I mean, they, as I said, you need your referral from your primary care doctor, and you can call the office at 607-385-3850.
385-3850. Doctor, I want to thank you so much for coming on.
Thank you, sir. Thanks for your time.
AM 1480 WLEA Hornell.